Hi, I'm Dr. Deok, working for Dept of Radiology in Asan Medical Center, Seoul, Korea. Today, we have one of our international visiting fellows, who is Dr. Ricky Kurniawan, and he is about to finish his 1-year visiting program here in Asan Medical Center. And today I invited him to talk about his life here in AMC, what he have learned and what he have done and what he have felt during the period. Please briefly introduce about yourself, your hospital, and your country.
My name is Ricky Gusanto Kurniawan. I'm a neurologist. I came from Jakarta, Indonesia, which is a capital city of Indonesia. I work at the National Brain Central Hospital. It is at the Jakarta. It is on-state hospital, which is the first pilot project of the Minister of Health of Indonesia. It is only specialty in neurosurgery and neurologists. In my hospital, because it is a top referral hospital in Indonesia, we already divided into sub-division. I'm at the neurovascular division. We divided into 3 groups of the division. One is the intensive and emergency care. Second is the diagnosis and ward. And the last group is the neurointervention, which is now at the neurointervention, we already have 2 neurointervention. So after I back, I will help these 2 previous neurointervention. The most I very admire about the friendly. A lot of people in here very friendly, even though that the limitation is they cannot speak in English very well, but they willing to try as hard as they can to speak in English. If I ask them, it's very for me, I'm so proud to have them in here. That is the most I appreciate in here. And the most impressive thing that in here is from the beginning, when I want to take in here the MMC, I have the recommendation because this is the one of the best neurointervention in Korea. In here, I have a lot of seeing new technique, new procedure, a lot of things in here. That is the most I like it in here. Maybe the language is the most limitation for me. And then especially for food, because I'm a Muslim, it's very hard for me to get halal food in here. But I wish someday the food will be at least a halal food. It will be better. Yeah. When I came here, actually my senior who fellowship in here, they did not tell me how should I learn the Korean before. But at the first time I came here, it's very needed to learn Korean. At the first 3 months I been in here, there is some professor in here teaching about the Korean language. She invited all of the international fellowship to learn about the Korean. But unfortunately, I cannot attend all the meeting because the time is not fixed with me, because on Friday I have to go to Jumat prayer at the masjid, at the mosque, in Taiwan, and it's very short time to go. I can get to go back here again. I think Asan Medical Center is one of the best neurointervention as far as I know. I have a lot of I see, and sometimes I participate a lot of procedure, a lot of technique in here, which is I can not see before, but in here we have so many cases It's very interesting, but I wish someday, for the international fellowship, we have maybe some standardization. I mean, maybe we have the curriculum for the international fellowship. So someday, if someone graduate from here, we have the standard from Asan Medical Center, which is we already have a good professor. We have already the best, so many procedure, so many technique. But if we have a curriculum which is a standard, I think it will be more better again. At least we can understand in simple conversation sometime, even though that is not very good, but at least we can understand it's enough. It's enough. And maybe another one is international fellowship. I know the limitation, a lot of procedure we cannot because the law. Maybe someday if it cannot break down, so doing with the phantom, it will be good again. I know the AMC Neurovascular will buy a phantom. I think it's very good sign. I told to the technician, I will be back after we have a
Okay. Today, Ricky gave me two things I have to do. One is prepare a kind of curriculum. The other is prepare an aircraft phantom for the hands-on experience of the visitors. Okay. Thank you. Thank you for your time. Bye. Bye.
Bye.